right treatments and support, people affected by schizophrenia and other serious mental illnesses can and do recover. The Coordinating Centers of Excellence within Northeast Ohio Medical University's Department of Psychiatry provide community partners with expertise and resources to bring best treatment practices and programs to people with serious mental illnesses throughout Ohio. Here are stories of how the best practices in Schizophrenia Treatment Center, the Criminal Justice Coordinating Center of Excellence, and the Ohio Program for Campus Safety and Mental Health are promoting recovery and instilling hope for people with mental illness, their loved ones, and their communities. A young man was experiencing delusions and paranoia in a public setting. A crisis intervention team, or CIT, law enforcement officer arrived, and using the de-escalation techniques for mental health crisis he learned in CIT training, the officer contacted the young man's father to learn more. According to the dad, the young man's symptoms were much worse when he was incarcerated. The CIT officer allowed the young man to avoid another unfortunate incarceration by persuading him to go to a mental health treatment center instead of to jail. Another CIT officer based in a college public safety office responded to a call about a young woman who was threatening to take her own life. The CIT officer convinced her to go to the hospital and rode in the ambulance with her to assure her she would get the help she needed. This was one of 50 calls requesting assistance of a CIT professional that was resolved entirely without the use of force on campus that year. The Ohio Program for Campus Safety and Mental Health offered a crisis intervention in higher education webinar to help other colleges and universities benefit from campus-based CIT programs. The program also offers collaborative program development grants to encourage campus community partnerships to address suicide prevention, promote mental health wellness, and provide substance use disorder screenings. These grants have led to self-care fairs, support for collegiate recovery communities that offer safe, supportive environments for students in recovery from substance use disorders, and other programs. The Best Practices in Schizophrenia Treatment Center, or BEST Center, accelerates the use of antipsychotic medications and psychosocial treatments to promote schizophrenia recovery. One young man describes his experiences with clozapine, a highly effective but underutilized medication for schizophrenia.
Before I started taking clozapine, I was tormented by racing thoughts and acute psychosis 24 hours a day. Within weeks of starting clozapine, I began to feel tranquility setting in. Being more independent is an important part of my recovery process.
The BEST Center provides medical professionals with training and consultation in how, when, and why to prescribe clozapine. The Integrated Care at Neomed Project ECHO program connects community providers to a team of multidisciplinary experts for virtual case-based learning and mentorship on caring for individuals with complex psychiatric and physical conditions.
I practice in a rural area and can feel somewhat isolated. I have been able to bring really challenging cases to the virtual learning community and get really good tips on how to manage them.
A BEST Center affiliated treatment team helped a college student to graduate with an associate's degree as class valedictorian to get a dream job in his field of study by providing first coordinated specialty care for first episode psychosis when he returned to college following hospitalization. Mental health providers trained by BEST Center experts in strategies informed by cognitive behavioral therapy for psychosis have helped individuals in a variety of ways.
I was taunted by voices telling me that I would be evicted from my home. My mental health provider and I used a reality testing strategy to check the evidence for and against what the voices were claiming. Reality testing helped me to make better decisions, including choosing to move to assisted living. Both my physical and mental health are better now.
Family education and support services have been very beneficial to a young woman with a serious mental illness and her partner, helping them to understand the diagnosis, communicate effectively, and overcome obstacles. She is using the education and skills she developed to improve her relationships with other family members. A young woman earned her Ohio Peer Recovery Supporter Certification and her bachelor's degree after completing first coordinated specialty care for first episode psychosis and cognitive enhancement therapy. Today, she shares her story of recovery and hope through many public speaking engagements. More about implementing coordinating centers of excellence practices and programs in your community, please contact Executive Director Ruth Samara